Good afternoon, everyone. My name is Caroline Segabarth, and I'm a sophomore at Paul Lawrence Dunbar High School in Lexington, Kentucky, as well as a member of the Kentucky Student Voice team. Welcome to the Louisville Rose Revival hearing on youth mental health. We are so excited to have you here today as we discuss this important topic of youth mental health in Kentucky schools. Let's start with an overview with an example of how legislative inaction and mishandling has led to issues in meeting the mental health needs of students. In 2019, we saw the passage of Senate Bill 1, legislation stipulating that school counselors should spend 60% of their time in direct service to students. It also sets the goal of one counselor for every 250 students as funds become available. But it is important to know that the 250 to 1 ratio muddies the waters because, in reality, there are different types of counselors. There are guidance counselors, trained to help us develop our college and career paths. There are mental health counselors who help us navigate anxiety and addiction. And there are school psychologists who mostly do diagnostic evaluations and consultations for students with disabilities. Today's hearing is a part of the Kentucky Student Voice team's Rose Revival campaign, in which we launched in 2023. For this initiative, we sent out to investigate the legacy of the 1989 Rose versus Council for Better Education Kentucky State Supreme Court decision that established the right to an adequate education. In Rose, the court defined what an adequate education means, laying out 7 capacities, or specific components, of an adequate education. You can see those 7 capacities posted around the room. They touch on civic preparedness, physical and mental well-being, literacy, and other subjects. Our Rose campaign has engaged thousands of Kentuckians, from Owensboro to Hazard, and what we have heard so far has been largely consistent. For the most part, people revere Kentucky's educators and school employees, but all too often, they're being let down by legislative inaction, inadequate funding, and political mishandling. These concerns are backed up by data. Per-student funding levels are at unconstitutional levels. Substantial portions of Kentucky students are not reading at grade level, and many schools are not meeting the school mental health professional to student ratio. After a year and a half of deliberation with organizational allies, students, educators, and elected officials, we decided that after 35 years, it was time to revive Rose. So, this past January, we filed a lawsuit, Kentucky Student Voice Team versus the Commonwealth of Kentucky. In it, we allege that our state government has failed to provide students with an education that meets Rose standards. You can read the full legal complaint on our website at ksvt.org/rose. As we stand here today, we are currently awaiting a decision in the Franklin Circuit Court on whether or not KSVT and 13 individual student plaintiffs have standing to bring this litigation. If or when the trial moves forward, it can take years to revise and resolve. But we understand that the courts alone cannot produce policy change. The conditions for a Rose revival require an engaged and informed public, one that is actively imagining what the education better system can look like. We know that systematic change is possible because we've already seen it here in Kentucky. The problem with the school counselors that I was talking about earlier is that you might end up with a school that has a mental health counselor to meet the target ratio, but still no professional to guide students in their college and career pathways. Even if you think the 1 counselor to 250 students is a great goal, schools have trouble achieving it. The average mental health provider to student ratio still remains closer to 350 to 1, compared to the recommended 250 to 1. Furthermore, because of the General Assembly's failure to fully fund its goals, at least 117 Kentucky public schools don't have a single certified school counselor. And roughly half of our school districts fall short of the goal of 1 school counselor or school-based mental health provider to a student. The indicators of these gaps are stark. According to a report called Indicators of Social and Emotional Health and Well-Being of Kentucky Youth, the percentage of students reporting serious psychological distress in the 30 days prior to taking the survey increases from 13.9% in 2012 to 21.7% in 2021. The number of sixth graders who mention seriously wanting to attempt suicide in the 12 months prior to this survey jumps from 5.8% in 2014 to 9.9% in 2021. So today, we are leading an inquiry into one of the 7 capacities mentioned in the Rose decision. Capacity 4 states, sufficient self-knowledge and knowledge of his or her mental and physical wellness. Today, we will hear testimony from 3 youth mental health experts, and we will hear follow-up questioning from student examiners. The purpose is to identify policies, practices, projects, and programs that can help address the student mental health crisis. That is to say, while our legal complaint lays bare the deficiencies of our current system, we are here today to surface some local solutions to those claims. And from the start, we want to acknowledge the sensitivity of this topic and the deeply personal nature of the discussions that will be taking place. If at any time during the hearing you feel the need to leave the discussion and step out, take a moment, please feel very free to do so. We also feel that any discussion about our public schools and youth mental health specifically should come from a place of appreciation for educators, school employees, and mental health professionals. The issues that our complaint highlights are structural issues stemming from inadequate funding and government overreach. The Constitution is clear about where the responsibility to remedy these issues lies, in our state legislature. 2 years later, from the other surveys we were talking about, when the Kentucky Department of Education's 2023 Youth Risk Behavior Survey was sent out, it asked Kentucky high school students if they had missed 1 or more days of school in the past 30 days due to stress, anxiety, or depression, or other mental health struggles. 30% of them said yes in just those 30 days. The rates of depression, stress, and anxiety are even greater among LGBTQ students, racial minorities, and students with disabilities. Our litigation makes clear that this is more than unacceptable. It is unconstitutional. So with that, I'll hand this over to Nate Reeves, who will introduce our expert witnesses.
Hi, everybody. How are we doing today? Thank you so much, Caroline, and good afternoon, everyone. My name is Nate Reeves, and I'm a junior at Scott County High School and a proud member of the Kentucky Student Voice team. We're now moving into the heart of today's hearing: testimony from expert witnesses and examination by our student examiners. With Caroline having laid out some of the deficiencies in our student mental health system, we want to now envision some solutions. Who better to give us that framework than 3 Kentuckians who've been working tirelessly on the ground to improve our Commonwealth's youth mental health landscape. So without further ado, I am excited to introduce our youth mental health experts. First up, we'll be calling Whitney Campbell. Whitney is a licensed marriage and family therapist, also right here in Louisville. Whitney received a bachelor's degree in psychology from Presbyterian College and a Master of Arts in Marriage and Family Therapy from Louisville Presbyterian Theological Seminary. Whitney has worked as a therapist in residential treatment facilities and domestic violence shelters, and has spent the last 9 years in the Jefferson County public school system. Next, we'll be calling Solyana Mesfin. Solyana is a current student at the University of Louisville and a graduate of Eastern High School. Solyana has been a member of the Kentucky Student Voice team since high school and was the first student ever to serve on the Kentucky Board of Education. In that capacity, she worked closely with the Lieutenant Governor and has been a fierce advocate for increased awareness of mental health in Kentucky schools. And finally, our panel will be questioning Lori Vogel. Lori is a child guidance specialist and middle school social worker with Fayette County Public Schools. Lori's been with FCPS for 26 years and currently works at Leestown Middle School. She's also a part-time instructor at the University of Kentucky College of Social Work. In 2021, Lori was appointed to the Kentucky Board of Social Work by the governor, a position she served in until this past July. Lori's also the past president and current advocacy chair for the Kentucky Association for School Social Work, and in 2019, Lori was recognized as Kentucky's School Social Worker of the Year. With that, we'll turn it to our examiners to call the first witness in the Rose hearing on student mental health. Thank you.
Good afternoon. My name is Journey Sanders, and I am a junior at Walden High School in Louisville, Kentucky. I have the honor of calling to the witness Ms. Whitney Campbell, a mental health counselor at Southern High School in Jefferson County. Welcome, Ms. Campbell. Please share your testimony when you're ready.
Thank you. Good afternoon. As mentioned in my bio, I am Whitney Campbell. I am a licensed marriage and family therapist practicing in a public high school here in Jefferson County. I provide individual therapy, group therapy, family therapy, and crisis support as needed in the school setting. I believe that mental health and mental health services are so vitally important for today's youth. There are so many challenges the youth of today face with the ever-present social media, a political hostile environment, and the still recovering climate of the COVID-19 pandemic. I have been a therapist in the school since 2016. I am currently in my 10th year, and the changes over the last several years have been astounding. When I started in the Jefferson County Public School System, JCPS, having mental health counselors was in its second year of existence. There were only a handful of us, many of which were split in different schools. I have been fortunate enough to have only been in one school during my tenure. In the beginning stages, there was a goal to eventually have a mental health counselor, now called mental health practitioners, in every school. What started as a small room of MHPs has now grown to having separate meetings to accommodate our large numbers. We are split into groups of elementary school MHPs, middle school and high school MHPs. There is at least one MHP in every school in JCPS. There are several schools that have multiple. This growth is so wonderful and much needed. I have watched the population and demographics of the students change in so many ways over the years. I have seen the need for mental health services grow exponentially since my start in JCPS. The COVID-19 pandemic brought about a spike in mental health requests and needs. I saw firsthand a generation struggling with depression, anxiety, social anxiety, and self-medication through drugs and alcohol. Lockdown was a challenging time for many people, especially youth who were cut off from friends, social activity, spending more time in homes that were not safe, spending unhealthy amounts of time on social media, and being away from structure. For many students that I work with, school was and is a safe place where students know there are safe and trusted adults, structure, and meals. Missing out on this for a year and returning to society brought about challenges in so many ways. So many had lost healthy coping skills or just didn't know how to cope at all. I am thankful to have been through it all as a resource and support. The schools not only have just the support of a school-based mental health provider, but the district also has a crisis response team that consists of counselors, MHPs, school psychologists, and family resource coordinators trained to respond when a school has a crisis. This is often the death of a student or staff member. A crisis response team is sent to a school when these events happen to provide support to the school community. These responses come for a variety of reasons, from suicide, gun violence, traumatic events, and other deaths. I have served as a crisis response team member since my first year. JCPS has also requires mandatory suicide prevention training in all schools from grades 5 to 12 to be completed within the first month of school, and then a refresher in the second half of the school year. Students are all shown a lesson on suicide prevention and are given the opportunity to provide feedback about if they or anyone they know is struggling with suicidality or any other mental health issues and are in need to talk to someone or of services. I am fortunate to be in a school with 2 MHPs and a youth service center coordinator that provides so many mental health supports from outside counseling, mentor groups, and specific affinity groups based around identity and mental health needs. There are so many options for students to find and receive mental health support. Some examples of groups in my school are Black girl groups, Black boy groups, Big Brothers Big Sisters mentor groups, Latinx, self-esteem groups, sources of strength, and more. My school has prioritized mental health because it believes that if our mental health is not in a good place, there are barriers to learning. We aim to remove and relieve barriers. Our hope is that we are not just educating students academically, but also socially, emotionally, so that they can become better versions of themselves and grow into emotionally intelligent and responsive adults. Students at my school have taken interest and have invested in their mental health, seeking out services, leading in different mental health initiatives and groups, such as sources of strength, and referring friends for services. This is the hope for breaking down the stigma of mental health that I hope will continue to grow. Thank you so much for your time and attention.
Thank you, Ms. Campbell. Thank you for sharing your testimony, Ms. Campbell. I have a few questions for you, and then Ishmael will have an additional question. And I also think that it's important how you know how much counselors are needed in this time in this day and age. So, Ms. Campbell, my first question is this. What policies or programs would help mental health providers in schools go beyond the superficial conversations many students experience to form deeper and more vulnerable and more authentic connections with them?
Thank you. Something I didn't mention in my testimony that we primarily try to keep my services for students who don't have access to they don't have private pay or insurance that helps them to be able to cover therapy. And I think that is something that's important to take in mind. And I think providing a space and prioritizing mental health would help to go deeper. It is important to note that heavy trauma may not be the best place for school therapy. It's hard to unpack a lot of heavy things and then go back off to math class. This is why I think that the referral system is so important. I think that having a space for students that they know this is my time where I don't have to focus on school and get right back to school, but this is a place just for me to be able to talk about mental health needs will help to provide a safe space for students to know that we don't just have to do surface level things.
Thank you, Ms. Campbell. Next, I want to know, how can we make counselors more visible and accessible to these students so receiving mental health care at school isn't perceived as hidden or stigmatized?
I think by doing just that, being visible. I know personally I make it a professional and personal goal every year to be more visible in school. So that's being out in the cafeteria, being in different academy meetings. We also do different initiatives in my school with mental health weeks, where we talk a lot about mental health. So to make sure that it's not stigmatized and just weaved into our fabric of just being everyday life. So having announcements in the morning and in the afternoon for specific weeks, doing mental health spirit weeks just to destigmatize that talking to someone is taboo, but it's something that we could all use and we all need.
Thank you, Ms. Campbell. My last question is, in Kentucky, female, LGBTQ+, and students of color are more likely to experience poor mental health. How can Kentucky schools reshape mental health curriculum so all students from diverse backgrounds can feel supported and engaged?
This is a really good question. I think representation matters so much, and personally, I fit the category for every category that you mentioned in this question. So showing up as myself is really important. I think that having representation is key. Having culturally competent counselors and therapists in the school system, so even if you don't fit those different categories, educating yourself and showing up and listening and being a really good advocate, and then knowing when to bring in different voices that can represent those communities so that students feel supported, and having curriculum that are created for and by people that represent those communities to help break down stigma and to help break down just what's not helpful when working with certain populations.
And good afternoon, Ms. Campbell. My name is Ismail Khan, and I attend Paul Lawrence Dunbar. I'm a freshman in Fayette County. Mrs. Campbell, only 22% of Kentucky students report always or most of the time getting the support they need at school. How do you think we can ensure that counselors are both available and accessible to students?
Thank you. My main answer to this question is to hire more. I don't think we can have enough mental health supports and services in the school. Personally, I work in a school that has 1,800 students. This is my 10th school year there, and when I started, there were 1,100 students and just one me. So the need was really high and just kept growing more and more. And every year, I have advocated to have at least another person to help. And because I feel like this is so important, and my administrative team also feels that it's important, we really push to have a second MHP. So I think hiring more people, really prioritizing having mental health services. I am also fortunate to be in a school that has a really good youth service center, and our coordinator has brought in lots of outside therapists that meet with students, and we have 6 counselors in my school counselors, so we have 6 counselors, 2 MHPs, outside counselors that come into the school. And I think having that variety of people is very helpful, because where I may be helpful for one student, I may not be helpful for another. So having a wide variety of people is helpful for making sure that everyone feels like they have a space. And just having enough people so that students don't feel like, oh, I don't have time to see Ms. Campbell because she has so many people she has to see. So hiring more, I think, is a big answer to that.
That concludes our examination, Mrs. Campbell. Thank you so much for your thoughtful responses to our questions. While you rejoin the audience, I'm going to yield the floor to Maggie, who will introduce our next witness.
Hello, my name is Maggie Donworth, and I am currently a sophomore at Tates Creek High School in Lexington. We will now start the examination of our second witness, Soliana Mesfin, a former member of the Kentucky Student Voice Team and was the first student representative on the Kentucky Board of Education. Welcome, Ms. Mesfin, and thank you again for being here today. Please begin your testimony whenever you are ready.
Thank you very much, Maggie. Good afternoon, and thank you very much for inviting me to be here. My name is Soliana Mesfin, and I'm honored to join the Kentucky Student Voice Team and all of you for this important conversation on youth mental health. During the height of the COVID-19 pandemic, I had the privilege of exploring mental health policies and programs with students across Kentucky. Through countless meaningful conversations with a diverse group of peers, we were able to amplify the importance of youth involvement in decision-making and in shaping the mental health practices used in our schools. we found that it's not just a single program or policy that can shift how we address mental health in our schools. What's needed is a cultural reset, one that actively works to break the stigma, expand access, and broaden resources. One that transforms the climate in our schools into spaces where every student feels supported. Because if we want to most effectively strengthen mental health support, we can't design solutions for only a select few. We have to create an environment that truly meets the needs of all students. There are several strides our education system can take to help enhance, support, and foster an uplifting environment for students. The first and likely most obvious step is staffing. We must ensure the ratio between students and mental health professionals is much closer to the nationally recommended standard of one counselor for every 250 students, like Caroline had said. In Kentucky, it's not unusual for one counselor to serve 400 or even 500 students. This is simply unsustainable. We should allocate funding to ensure at least one licensed mental health professional is present in every K through 12 school, so that no student ever finds themselves in crisis without anybody qualified to turn to. We must also be intentional about hiring staff who reflect the diversity of our student population, including people of color, LGBTQ+ staff, and those with a wide range of lived experiences. When students see themselves represented in the professionals around them, they are more likely to feel safe, understood, and comfortable in seeking help. In addition, schools should implement regular, meaningful check-ins with students, not just state-mandated surveys that feel impersonal, but genuine opportunities for young people to share how they are doing. Policies such as excused mental health days, trauma-informed training for staff, peer mentoring programs, and mental health materials and resources in every classroom can further foster a supportive and stigma-free environment. Over the years, I've heard many success stories from students regarding how their schools have addressed mental health. Some schools have implemented mandatory advisory periods where mental health curriculum and support are constantly provided. Others have created partnerships between districts and local mental health facilities to connect students with long-term care or medical resources. Students themselves have started clubs and programs like Sources of Strength, which have become vital avenues for expressing needs and supporting overall well-being. Across these examples, the most effective strategies involve heavy student involvement. Students know what is best for their own needs and the most effective ways to execute support programs. This is why student input in decision-making is vital to truly fostering safe and effective school environments. Whatever policy or program is passed, whether at the school, district, state, or national level, it must be shaped by student voices to have a meaningful impact. As a student in Kentucky's public schools not too long ago, I remember the stigma surrounding mental health holding me back from seeking help and the limited resources that were available. Ultimately, I struggled for a while with things that could have easily been addressed. The millions of students that come out of our public schools deserve to come out of K through 12 with genuine prosperity and hope for the future. Our main goal as advocates and stakeholders should be to preserve the well-being of our students above all. Once we have this priority, we will see our students flourish in academia and as community leaders. Thank you, guys.
Thank you so much for sharing your unique insights with us, Ms. Mesfin. I have one question for you today, and then I will hand the floor to Ismail, who will take 2 additional questions. Ms. Mesfin, as you may already be aware of the research that shows that no fewer than 43% of Kentucky's LGBTQ students have seriously considered suicide in the past year. From your experience, what changes does the state most urgently need to make to support these young people? What should we be doing to reduce the risk of self-harm and suicide, given our political climate and laws like Senate Bill 150 that target LGBTQ youth?
Yeah, thank you so much for the question. It's a heartbreaking statistic, and it's a sad reality, especially in the state that we live in, given Senate Bill 150 passed in 2023, I believe. It's hard to create a culture and environment where LGBTQ plus students feel safe, especially when we have legislators attack their livelihoods in our schools. I think it's important to do any little thing that shifts the culture in our schools, whether that be starting gay-straight alliances in schools that don't have them, teachers and staff in our schools respecting pronouns as much as they can, and overall just creating an environment where LGBTQ students have community and where they're able to prosper without a lot of the harmful rhetoric that we hear from legislators in our state. So I would encourage every stakeholder to make it a priority, given the very disturbing statistic that is not only in this state but across the nation, to try their best to be trauma informed, specifically on LGBTQ hardships and troubles that they go through as young folks, and do their best to create safe and healthy environments.
Thank you for answering my question. I will now pass it off to Ismail.
Thank you, Maggie. And hello, Ms. Messman. Ms. Messman, as you are a former KSVT member and student member of the Board of Education, we know that you are passionate about student voice. How can we involve students in the decision-making process around our school mental health policies and practices? And what steps can we take to ensure student voices are heard?
Thank you, Ismail. I've preached this so many times. Kentucky Student Voice Team is probably, well, not sick of hearing this from me. They support it as well. But students need to be on our decision-making boards and councils and everything like that. I had the honor of being the first student board member, and that experience was amazing, not only for myself and fellow students, but for the board and their decision-making going forward. And so the student voice that these decision-making bodies have or should have in the future make an extreme impact. And not only that, they do need voting power on these boards as well, so that students have an impact on legislation, policies that are going through our schools and so forth. And so in regards to mental health policies and things like that, these students are in the classrooms, on the ground, receiving a lot of these programs that are set up to help students, and so they are the true experts in whether certain things work, whether they don't work, and things like that. And so I believe that students have just an invaluable outlook that maybe not a teacher would have, or a counselor, or anything like that. And so this is why we deserve to be in these conversations, as well as having a powerful say in how we move forward in our schools. So yes, student voice is very important.
Thank you for your response to my first question. For my second question, Ms. Messman, I'm wondering if you can tell me what policies can help counselors identify and support those students who are struggling with intense academics, athletics, and extracurricular pressures. Thank you.
Yeah, I think ultimately it goes down to closing down that ratio of 1 to every, 250 students. That's what's nationally recommended, but doing our best to close the gap between counselors and students, and also staffing more counselors, because I believe if the more intensive support that a student can receive can truly help them with these mental health struggles that they're going through. And I think it's really important that adults in our schools, whether that be counselors or teachers, are really able to get to know their students on a deep personal level. And therefore, it would help the student in confiding in them and, maybe help, the struggles that they're going through as well. So that's definitely one policy that we can implement or definitely advocate for moving forward. And again, going back to the point of doing everything in our capacity, even if it's at a small level, but just mental health check-ins on students, having those mandatory but meaningful conversations, and just have every staff member in our schools just be thoughtful and trauma-informed as well on how to help their students, even though if it's not at a professional level like mental health practitioner, but just doing anything they can to get close to a student and giving them advice and just gain those meaningful connections.
Classrooms all across the Commonwealth, the mental health and well-being of Kentucky students. We know that schools are not just places for learning and academics. They are where children form friendships, develop coping skills, and often encounter the first signs of emotional distress. Right now, our students are struggling. According to the Kentucky Youth Risk Behavior Survey, roughly 15% of high school students have seriously considered suicide in the past year. 10% have actually made an attempt. And nearly 40% report persistent feelings of sadness, or hopelessness. These are not abstract statistics. These are calls for action. Kentucky has made some real progress in setting up legal and policy infrastructure for school mental health by mandating or requiring suicide prevention trainings 2 times a year, along with a makeup for students who are absent on the day of the delivery, a trauma-informed approach and trauma-informed teams in schools, trauma-informed plans incorporated into comprehensive district improvement plans that are reviewed annually, anonymous reporting tools for safety issues and trauma exposure, the ratio of 1 to 250 school-based mental health service providers to student, and also by allowing mental health concerns as an excused absence from school and requiring emergency phone numbers like 988 to be listed on the back of all students' school badges. But the gap between policy and practice remains significant. So, what can schools do? Sorry. What additional policies, programs, and practices are most effective? Sorry, I don't know where this is coming from. First, staffing is the foundation. Kentucky's Senate Bill 8, passed in 2020, recommends a school-based mental health service provider for 250 students. This ratio is not arbitrary. It reflects national research showing that providers with manageable caseloads can deliver preventative support, conduct small groups or individual interventions, and follow up consistently. Yet many schools are far from that ratio, with providers carrying 500 or more students. With adequate staffing, even the best programs cannot reach students consistently. Funding to meet 1 to 250 ratio must be our top priority. Second, evidence-based social emotional learning, or SEL, should be integrated across all grades. Decades of research show that SEL is one of the most effective preventative measures schools can implement. A landmark meta-analysis of 213 studies involving 270,000 students found that participation in SEL programs improved social and emotional skills, behavior, and mental health, and increased academic performance by an average of 11 percentile performance points. In other words, SEL makes students healthier and helps them learn. Third, schools should adopt Positive Behavioral Intervention and Supports, or PBIS, which is a proactive, data-driven framework that many schools in Kentucky use to improve behavior, increase safety, and support student academic achievement. PBIS uses multi-tiered system of supports, or MTSS, to classify the level of need a student may have. PBIS aligns universal SEL instruction with targeted intervention for students at risk. Programs such as ones at my school include Ruling Our Experiences Girls Group, CBITS, or Cognitive Behavioral Interventions for Trauma in Schools, Coping CATS, and Refresh Vaping Interventions Group. These provide small groups or individual supports for students with early signs of behavioral or emotional challenges. These tiered supports ensure that students are directed where they are most needed while still maintaining school-wide prevention. Currently, these types of groups are also seen as an extra in many schools, and funding for those can be limited. I personally have found through grassroots organizations funding, but funds can be limited on how many times or how often a school requests them. It is more challenging to find these types of funds in rural areas. A state fund dedicated to assisted SEL program in schools would help make these opportunities available for all students in Kentucky. Fourth, we must involve students themselves in shaping mental health policies and practices. For examples, initiatives like Sources of Strength empower students to become messengers of hope and resilience, spreading positive coping strategies and normalizing help-seeking behaviors. When students hear from their peers that it's okay to ask for help, the stigma surrounding mental health begins to crumble. In addition, student advisory boards allow young people to give feedback, identify unmet needs, and help create school environments where mental health is normalized, not stigmatized. Currently, schools can receive a grant to implement Sources of Strength from the Kentucky Department of Behavioral Health, Developmental, and Intellectual Disabilities, but it is uncertain how long this funding will continue. While we have made some gains, attention should also be placed on removing barriers that have recently been created by legislation in Kentucky. The first example is the law that restricts the confidentiality of students in schools when they use student support services. LGBTQIA+ students should be able to speak openly with school-based mental health providers because having a trusted confidential adult to discuss identity, relationships, and experiences of discrimination or stigma is critical for their emotional well-being. School mental health providers create a safe space for guidance, support, and referral to resources, which can help prevent anxiety, depression, and suicidal thoughts that disproportionately affect LGBTQIA+ youth. A second barrier that restricts schools is not allowing students to participate in surveys about mental health and substance abuse without parental permission. These types of surveys are essential for identifying trends, risk factors, and unmet needs across the student population. Collecting this information helps students design evidence-based schools and allocates resources effectively, and can create targeted prevention programs, ultimately promoting safer, healthier learning environments where all students can thrive. There are immediate changes schools can implement, even without additional funding. These include flexible counseling schedules so mental health providers can meet students individually or in small groups. This should include removing student support staff from supervision duties such as lunch or recess supervision. Senate Bill 1 and Senate Bill 8 both require that mental health providers have a 60 to 40% ratio of direct to indirect services to students. This is an area that could quickly be remedied in schools. Daily SEL check-ins or classroom meetings that provide spaces for students to express emotions and practice coping skills. Trauma-informed routines, predictable classroom structures, and restorative approaches to discipline. Peer support networks, mentoring programs, and student-led mental health clubs to foster connectedness. Finally, if the state could invest in just one area, it should be funding school-based mental health service providers to meet the 1 to 250 ratio. With adequate staffing, every program, SEL, tiered interventions, trauma-informed approaches, become far more effective. Providers can identify early warning signs, deliver interventions, and create the consistent, trusting relationships students need to thrive. So to summarize, Kentucky students face serious mental challenges. Evidence-based programs and interventions exist and are already to be scaled, but without proper staffing, training, and student engagement, we cannot realize their full potential. By funding adequate school-based mental health providers, expanding universal SEL, implementing targeted tiered supports, and involving students in the process, we can create a system that prevents crises before they occur, improves academic outcomes, and strengthens the overall well-being of Kentucky children. Investing in these measures is not the right thing to do. It is the smart thing to do. Every dollar spent preventing mental health crisis saves money, time, and lives down the road. Most importantly, it ensures that our children grow up healthy, resilient, and ready to succeed. Thank you.
Thank you, Ms. Vogel. I now have 2 questions for you, then I will pass it off to Maggie, who has a third for you. Ms. Vogel, given that 58% of students have experienced trauma in their lives, how can schools better identify and reach students who have experienced trauma, especially those who may not openly seek help? And what trauma-informed practices could be expanded or introduced to ensure these students don't fall through the cracks?
One of the first is universal screenings, and those are surveys that students would take to help identify if they have needs that staff can help deal with. And unfortunately, unless parents opt into those programs right now, they aren't allowed to happen. In Fayette County, we do the DESA, which is a social emotional survey. And, I am in a school of 1,100 students, and 400 of those parents opted in. 400. So that's a really small proportion of the amount of students that we have. I think also training staff on youth mental health first aid is important. That way teachers can identify when they see problems. Mental health literacy classes for students that are in secondary grades. By helping students be able to identify what anxiety, what depression is, then they themselves can go and seek help. Also, seeking out our internalizing and externalizing students just from school data. For instance, our school nurse is going to be able to tell you all the students in our school that are internalizing stress. They're the ones that are coming to the nurse's office that have stomach ache or headache every other day. Also, as far as our externalizers, we have kids that have referrals, so looking through the behavior data, and also attendance. Typically, kids are missing school for a reason, and looking at that and trying to make interventions with those students is going to identify some other kids. Then also providing a confidential system in the school to help them be able to see a mental health provider. We have in our school just a simple little bit.ly that we put on their canvas, and if they want to see us, they just click it and are able to type in what they need and who they would like to see. As far as what are trauma-informed practice that can be expanded, in Senate Bill 1 and Senate Bill 8, it required schools to implement a system in which all students in the building are known well by one staff member. So just having that staff member knowing that student well and being able to identify that, there seems to be a problem here, let's get you some help. I think that, that was a smart thing that is in legislation, but unfortunately I don't know that it's very well known and is implemented with fidelity. Having all staff trained in trauma-informed practices, not just the student support people, is very important. And having that being a live training, like in a staff meeting, instead of the online trainings we do at the beginning of the year that you click through and don't really listen to. Not that I do that, but. Also being currently aware of who the students are in your building culturally, where have they come from. My school is about 45% English language learner, and so knowing where those students came from, we had a large population of children from the Congo, knowing that that's a war-torn area. These children have been exposed to something, or else they wouldn't be here today.
Thank you. My next question has to do with mental health counselors in school. In your testimony, you said that many schools cannot meet the 1 to 250 ratio and that staffing is a major concern for school mental health professions. If Kentucky can't reach the 1 to 250 ratio, what are the short-term strategies or methods the state should implement that would bridge the gap?
Well, I think, again, having all students known well by one staff member is a great way to at least be able to bridge that gap somewhat, because those teachers and staff members are going to be able to see, oh, this child has changed, or they told me this. And even though they're not mental health providers, if they are trained in youth mental health first aid, then they can identify that we need to bump this kid to the top of the list because they are having some concerns. Also maximizing your community partners. We have a lot of partners at my school, thankfully. We have the Center for Grieving Children that comes in and does a grief group. We have Operation Make a Change that comes in and talks to kids that are at risk for violence. We have Kentucky Key Assets that comes in and helps out with seeing our most at-risk kids our kids that need therapy the most. Mentoring programs. We have teachers who have started after-school programs. We have a group called Kappa Club for boys that are at risk. We have a girls group called The New Standard. There's 30 to 40 kids in these groups that help out with just being able to be there. Also, we utilize our practicum students from the University of Kentucky who are working on their master's degrees in counseling, psychology, social work, they're able to hold a caseload with the right supervision, so they're also able to help out with that.
That concludes my questions, Ms. Vogel. Thank you for answering them so thoughtfully. I'm now going to yield the floor to Maggie.
Thank you, Manya, and good afternoon, Ms. Vogel. For this last question, I am wanting to know, do you see a difference in the resources and Do you see a difference in the resources and cultures in urban schools like your own in comparison to more rural school communities? How should the state respond to these differences in addressing student mental health?
Well, yes, there is definite difference. I grew up in northeastern Kentucky, and just keeping in touch with, the mental health providers that are in the district where I used to live, it's a big difference, a vast difference. I grew up in Lewis County, and they just got their first mental health provider a couple years ago, beyond their regular school counselors. So staffing in larger urban districts, there's a larger tax base, so it's easier to be able to provide different services to students, such as even school social workers, school psychologists, mental health counselors, even intervention teachers, or even English language teachers. So, rural districts many times have to piece together one person for the whole district, whereas in more urban districts, we're kind of able to have a little bit more service. Plus, we also have a better access to mental health just in general. There's more mental health providers in urban districts versus our rural areas. Psychiatric services are very difficult to get in your rural districts. And, for an assessment, if you have a student you feel needs to be assessed for suicide, you could possibly go 2 hours to get to a hospital. One of the things that we've been utilizing a lot recently is a partial hospitalization program. And so this is a program where a student would go during the school day and then they would go home at night. Well, if you live in, Lewis County, that's really not going to be possible for you. Also in our more rural areas, there is more of a lack of diversity. So minority students feel more isolated, and sometimes when stigma is more of a cultural issue, there aren't a lot of people to be able to talk to them to try and assist in changing that stigma. And bilingual therapists, those are hard to even find in the city. So in rural areas, that's really difficult. Telehealth has helped, but even in rural areas where my parents live, there's no cell phone service. So even there, it's hard to, even using telehealth is difficult. One thing that I've been advocating, oops. Let me turn it off. One thing that I've been advocating for over the last several bienniums is an increase in the $7.4 million that the legislature did provide for each district to have mental health services. It was a great start, but $7.4 million divided by 171 districts is $43,000. And you got the $43,000 whether you were Jefferson County with almost 100,000 students or you were Augusta Independent with 337 students. So there needs to be a plan to overall increase the funding, and two, to come up with a formula to disperse the funding where it's most needed. One thing you could look at is the use of time for mental health providers that Senate Bill 8 did require, and that's a survey that each district has to complete every year to tell you, where they are to that 1 to 250 ratio. So I think that looking at what that is, the ratio for certain districts that still can't meet that, and being able to increase that funding so that they can have more mental health providers is a way to start.
That concludes our questions for you, Ms. Vogel. Thank you so much again for being here today and sharing your solutions to the challenges to supporting student mental health. Our timekeepers tell me that we have a few minutes left for questions from the audience. I'm going to pass it off to my colleague Nate, who will field questions from all of you.
Thank you so much, everybody, and thank you, Maggie. It looks like Maggie said, we'll actually have a couple minutes for some audience questions. So if any of you are interested, we have a microphone up here if you have any questions for any three of our witnesses. And yes, feel free to stand up and ask a question.
I'll warm things up. This is actually a question for all of our witnesses. In Kentucky and across the country, as you well know, schools have been experimenting with cell phone policies. The reason and the rationale is to protect student mental health. I'd love to hear what you think of the policies that you've seen, if you have a sense of best practices for cell phone policies in schools. I'd just love to hear your take, and this is a wireless mic, so I can pass it along.
I can take this one being in high school. I was really nervous about what this year was going to look like, having the new cell phone law, and then with JCPS saying that from the hours of the first bell to the end of the school day, not having any cell phone use at all. I thought there would be a lot of pushback from students, but it has been really refreshing to see students getting back to knowing how to socialize with each other and talk to each other. Just walking around in the cafeteria and everyone's not on their phone has been really great. They have to interact with each other and talk with each other. I've noticed too that the number of fights and things have gone down because students aren't constantly on their phones keeping things going, that where we might have started some conflict with each other in person that just keeps going on social media and text message. So I think it's been really good.
Fortunately, the school that I work at, Leestown Middle School, has always had a cell phone ban. So this is really not a big change for us. You know, there are kids, obviously, that get it out anyway when they're not supposed to. Usually it's in the bathroom when they think there's something funny going on, but these are middle schoolers. But, you know, we've been lucky. You know, if a kid gets caught with the cell phone the first time, it goes to the office, and they have to pick it up at the end of the day. If they get caught a second time, then the parent has to come pick it up. And if they get caught with it a third time, it has to spend the night at school. Now that really gets their attention usually. So, but it's, you know, we luckily not had the problem too much yet.
Yeah, I think like both of the witnesses have said, I agree. I think cell phone ban or the cell phone policy does increase just awareness with students and overall interaction. I think it's good for students as well. I was a student in in a school where cell phones were not allowed, and I definitely was on a cell phone once or twice. But I think ultimately, I think having that, even though it didn't feel great in the moment, I now realize that, okay, I was way more aware. I was able to pan out, you know, things for my classes later that day instead of being distracted from my phone, or I was more focused on school and my peers, and so in that way I support it. I think if leniency can be provided from administrators regarding, you know, things like emergencies or, you know, overall safety, and, you know, our public schools can be very dangerous environments sometimes, so, you know, as long as there's leniency and of course if students don't abuse it, I think cell phones can be beneficial in schools, and they have been in the past, but yes, overconsumption is not something that I stand for or support, and I think there needs to be a healthy balance, and for students to recognize that there is life to school beyond a phone.
this.
Okay, I have a question. Senate Bill 181 restricts teachers, coaches, anyone having contact with students outside. I want to get your feedback on it. As being the PTA person in the school, we had a student on our board, but now I can't contact them without a form, and then everybody's got to have that form because we can't do that text message. That would make things easier. But I know my child had a relationship with several of his coaches, his academic coach, and just teachers in his school that he had a relationship with. And now he's graduated in college, but that would have been really difficult for him not to be able to have that conversation, because if something's at home and he wants to have a little time to talk to someone that he trusts, that's now a no-no. I just wanted to get your all's feedback, what your all's thoughts were.
Anyone want to comment on 181?
That's a hard one because I see both sides of it as a mental health provider, But the thing is that they made a law over something that's very rare, really. I mean, and the thing is that if someone is going to try and abuse a child, this isn't going to stop them from doing that. They're going to find another way, they're going to do something, and they're going to do it anyway if they are breaking the law. So, as a mental health provider in a school, I'd never do that, give students my cell phone. I mean, one time we were in the Capitol with the governor and he was taking pictures with the kids, and that's probably the only time I've ever really done that myself. But, when my son was on a soccer team, he would get texts from the coach all the time, and that made sense to me. So, I think it's an overreaction of something that is rare and will happen anyway, even with this law.
We'd love to hear from any student who wants to respond to that question too. Caitlin, would you like to respond to this question? You did have your hand up. To ask a question or to respond? Oh, ask. Okay, just 1 second. Hold that thought. If anyone wants to respond to whether or not you've been affected by this new legislation.
Hi, my name is Abby Ladwig. I'm a senior at Owensboro High School. And this piece of legislation has impacted me a lot, mainly just inconvenience. I'm a part of a lot of clubs, and it makes it really hard to coordinate anything, because text message is really easy to just text someone and be like, hey, do we have practice today? Hey, can you help me with this? Hey, can you get this resource for me? And now I have to email teachers, and emailing them is a little more inconvenient, and it takes a lot of time, and I've missed a few practices. A few of my academic team practices because we cannot coordinate things. Because before I could just text and then text it back out. And now we have to use some Talking Points app, which doesn't work for a lot of students. And again, I completely agree with Lori. People are going to do bad things. They were breaking the law before. The law obviously does not matter to them if they were breaking it before. But again, I see both sides of the argument. But I guess we'll have to see how it plays out. I think coming this legislation session, I think they will make amendments to it because it very obviously has caused a lot of distress. And before, even just being able to talk to some of my teachers and text them, actually one of my Spanish teacher, I communicated with him just on a personal level, and we got chickens. Both me and him, how you have to go to Tractor Supply, you have to get 6 chicks. We were able to split that. He got 3, I got 3, right? That type of relationship that you're able to have with your teachers, I think is really important. And now I can't do that anymore. And I think, again, bad people are going to do bad things, and this probably will not stop them.
Caitlin.
Thank you. So I'm Caitlin. I'm a freshman at Lafayette in Lexington, Kentucky. You all mentioned diversity in schools as a problem regarding mental health. What is the effect of House Bill 4, which is about DEI? What is the effect of that on mental health in Kentucky students?
I'm not 100% up on that one. I thought it was more related to colleges and universities. So hopefully it doesn't have any issues with school services, but we need more diversity in our mental health, as Whitney said, and I hope that we can focus on that and not just that we need mental health providers, because we need mental health providers of all backgrounds and histories and cultures.
I'm not familiar with that bill either, but I would say personally with my school, we really try to get providers that represent a wide variety of students, because we, like I said, have prioritized mental health and making sure that everyone can see themselves represented and feel like they have a safe space to talk. But we have therapists that speak different languages to work with students, all kinds of role groups. So just really making sure we have a wide variety of people.
Yeah, so what I know about House Bill 4 as well is from a post-secondary education standpoint. A lot of what I've seen over the past couple years, even here at the university, is kind of like restricting language on diversity, equity, inclusion, and kind of making it as though it doesn't exist, kind of making it as though, trying to restrict anything that provides support to our minority students, and things like that. And so as I imagine it would translate in K through 12, I think it would be very dangerous as well, because as we said, mental health, counseling, mental health, just support overall needs to be DEI based in a way, or just, has to, we just have to keep that in mind as we go through providing support for our students, because a lot of minority students often don't reach out for help, or they don't know the avenues in order to do so. But when they see things like representation or specific resources for them, they are more likely to take advantage of those resources and connect with individuals they feel as though understand them. So that's why I believe diversity is so important within this mental health conversation. And if we were to follow the same, things as House Bill 4, it would kind of be erasing it in a sense, and that would cause extreme detriment to our students and to our faculty too, that want to genuinely help the students in need. And so, yeah, it's just moving forward, and I think doing the best that we can to seek minority groups and folks that don't always receive support, and help them as much as we can given the legislation.
Any further questions from the field? I believe we've got time for one or two more questions. One more. All right. Anybody else?
All right, hello, and thank you so much for your insights. I wanted to ask, what can we as parents do to help out? Because I hear everything, obviously, from like all the administrators and teachers, but how can we support the parents? I mean, we can be a part of the PTA, we can do something, but what do you need from us that we can help the school specifically?
I know for me, just having parents that are involved and willing to listen to what their child is going through, and being an open place where you can talk with the provider and the student. A lot of issues that students that I see come with is that they don't have that support from home. So having support from home would be so helpful. And then just like with our teachers having mental aid, first aid knowledge, parents also getting some of that too. So if schools could do a good job of things that teachers are getting training for, having a little bit of lightweight training for parents to be able to have. So if your kid is coming home and they're having these issues, what are some resources, or what can I do in the moment, some coping strategies, things like that. And also just knowing things to look out for.
She pretty much said everything I was going to say. I think, just as a parent, just listening to your child, mine's sitting back there, hopefully she thinks that, and not panicking the first time you hear something out of your child's mouth that scares the crap out of you, because they will scare you. So, yeah.
I agree with both of them. I think, just like Ms. Campbell had said, I think the biggest sentiment that I got regarding mental health in K through 12 was like, yeah, parents, my parents won't understand, my parents won't get it. And so that also too prevents people from seeking help as well. And so it's scary when you feel like, maybe you can't trust a parent or your peers or anything like that, and so you feel very limited, and so you feel like you have to confine it on yourself. So that's why I think support at home is very important, as much as possible. And in terms of parents, what they can do to our schools, I think too, if you as a parent have the privilege of being with your child after school, and you see maybe there's things that they struggle with or things that might be affecting their mental health, use those things. Well, one, encourage them to seek help, of course, or to confide in you, but also use those things to influence policy in your school. So just like you said, being active in PTA, and also go to your local school boards, meetings, and voicing your concerns about your student, or just some patterns that you're seeing as well. I think parents have a very interesting perspective as well, and a unique one, because they genuinely care for the student in most cases, and they're concerned for them. So in times where students are unable to fulfill that need of seeking help, I think parents have a unique role in advocating for them and supporting them along the way. So yeah, whatever is best for you and your school, and just advocating not only for your student but for others who maybe don't have that same parental support.
I would like to add something too. Just like we were talking about breaking down stigma for students, I think breaking that down for parents is also would be helpful. So having parent support groups, like parents supporting each other, supporting their kids, because something I run into a lot too is that parents feel like this is a home issue, you don't need to take that to anyone else outside the family, when it could be very helpful having those supports. So breaking down stigma with parents about what taking care of your mental health looks like, that there's nothing wrong with you because you need to have any help. And like I said before, all of us could use someone to talk to. Therapists have therapists, because we all need people and supports to talk about these things. So really breaking down with parents the stigma of there's something wrong with my kid, or there's something wrong that I'm doing that they need to go and talk to somebody, but just knowing that it's okay for everyone to have someone to talk to.
Yeah, and I'll add, you kind of jogged this in my thought. Go to your school board and say, we need more mental health practitioners in our schools. Go to those board meetings. Call the legislature. Call the line. You can call the line and leave a message for every legislator there. We need to increase the ratio of 1 to 250. So I'm going to start reduce the ratio as my theme for this next year.
Thank you so much to our wonderful expert witnesses and our wonderful student examiners. While I'm making my way up to the podium, could you just give it up one more time for these wonderful human beings?
While he's going up to the podium, I'm going to echo on your comment. The state budget is actually is being drafted right now. So now is a really good time to call your state legislators, just to tell them that you want that.
And this is a state legislator, Representative Don Worth.
We hope you will continue to stay connected with the Kentucky Student Voice Team and continue joining us on our Rose Revival campaign. We've got some pretty specific ways to do it. At each of there will be QR codes around the event that will take you to our webpage. You can stay up to date on the legal proceedings and when our next hearings are scheduled by signing up for our email newsletter. We have a few more exciting projects coming down the pipe, and we want to share some information about how you can keep an eye out for when they launch. What are they, you want to know? I'm so glad you asked. Later this fall, we'll be releasing a book about our Rose Revival campaign and litigation. The book takes a deep look at the Rose legacy, breaks down our historic legal complaint, and introduces our Rose Revival campaign. As if that weren't exciting enough, as part of the campaign, we are initiating our Rose Ambassadors program. The goal is to build a grassroots network of volunteers and supporters to discuss the campaign and join our advocacy throughout the Commonwealth. All of this information will be shared in our email newsletter and available on ksvt.org/rose. You can also find multiple calls to action, including endorsing the campaign, an op-ed writing toolkit, and a form where you can share your own education story. We now conclude our Rose Revival hearing on student mental health. Thank you so much for spending your time with us today, and we hope you have a great Saturday afternoon.
We will be hanging out for a few minutes in the audience, but as we do, I just have to do one extra shout out to our hearing examiners and also call attention to, we have a birthday girl on the stage. Maggie Donworth is 16 today. Happy birthday. Thank you.